Welcome everybody to this next video on the Abundant Living Ecuador YouTube series. So in today's episode, this is a professional spotlight on one of our local Vilka Bamba health and wellness practitioners, Bruno Chikly. It's an honor to be with you here today.
Yeah.
Yes. And Bruno will be talking much about his background and also about how he is participating in the health and wellness retreat that Abundant Living is hosting in October of this year. So stay tuned for information to come about that retreat. And before I read through the deep background and the many different modalities and training that you had, Bruno, I will remind the audience that if you like this video and you want to be notified when more content comes out, specifically around the health and wellness practitioners that are going to be part of the October retreat, don't forget to subscribe to the Abundant Living Ecuador YouTube channel, like this video, and especially hit the little bell because that will give you the notifications to let you know when we have new content out. So Bruno, welcome. So nice to be here with you in your beautiful, lovely home. We can see some of the gorgeous Vilka Bamba background here, not quite the mountains in Mondango, but I know we're nestled in the valley at this moment.
Yes.
So I'll share a little bit about your background, and I have this written down because the list is long and exciting. So, and you'll have to set me straight if I get any of these details incorrect, but I have it here. I know you are an osteopath and a medical doctor. Yes. You're also trained in endocrinology, surgery, neurology, and psychiatry. And I can't wait to hear about the beautiful blend of how these modalities are not separate, but they're all together as part of the wholeness. You are the founder of the Chikly Health Institute, and this is a global organization that's devoted to education, research, and therapeutic excellence, which I've experienced some therapeutic excellence firsthand in a session with you. And it's really worth mentioning that this organization or your practice for over 20 years, you and your teams have trained over 18,000 practitioners. Do I have that right?
Yes.
Okay, so it's not a typo here. I got 18,000 practitioners. I found that incredible. I didn't know that. I knew you had a wide range of experience working with people one-on-one and also teaching other practitioners. So that's incredible. I'd love to hear more. And I have to mention too that your wonderful wife, Alea Chikly, is part of the Institute, and her heart-centered therapy is also going to be part of our health and wellness retreat in October. So that's a separate video. We'll get to that one. And I really look forward to having that interview as well, because knowing both you and Alea, the energetic balance and sweetness, there's a magic that's there. So I would love for you to maybe speak about how the two of you kind of hold the field and doing different modalities, but it's woven together is what I feel deeply. So all of that said, I would love to hear from you a little bit, whatever feels right in this moment to share about your story, including the why that's behind the work that you do today. What is it that you love about today's practices that you are able to offer to other people?
Well, what it is right now we are kind of, Alaya and me, in the maturity of our arts.
Mm,
And so we answered some of the questions we had when we started. When I started, my first question was about 6 years old. I wanted to understand why people look a certain way, but talk from a different place.
mm,
So I saw the mask
yeah.
in people very early, and I knew it was not healthy. And I knew I wanted to find a way to bring together people into their more sincere, authentic self as a healing modality.
Yes.
So that's really the background. That's a question that started with me a long time ago. And I went to medical school because I wanted to have all the training I could.
Yeah.
But at the same time, I started doing Aikido when I was 12 years old.
When you were 12.
12.
Wow.
Yeah.
Okay.
I had
Okay.
a lot of energy. I still have a lot of energy. And my father was an accountant, and he had this Japanese guy, and he was the first
Yeah.
Aikido master coming straight from Japan, a samurai in the middle of Paris. And I trained with him, and it's a totally different background.
Yes.
Because in Chinese medicine, when somebody's sick, you start with maybe changing the food or giving them a qigong movement, or giving them a different, type of, condiment to balance the five elements. Then, you do acupuncture after that. It's a bit more invasive. And then you work differently, completely differently with Chinese medicine. So when I went to med school, being trained in Oriental medicine without even knowing it, giving health to everybody through Aikido and breathing. I went to a place when it was such a different background when you have to have something broken to be sick. If they couldn't find a bone broken, an artery clogged, or any kind of immune system problem, you didn't have anything wrong. They had to see something physically out. If not, it was a lot of time the MD will say, well, this is psychosomatic, this is a virus, we don't know. And it was very limited, but very specific and very technical. So it was for me a shock a bit to went to med school to see that really black and white dual way to look at things. In Ayurveda, for example, they will describe 3 types of medicine. You have the medicine of the gods and the angels or gods, which is to heal you with mantra, with breathing, with yoga, with however. Then you have the medicine of the human, would be the plants, and then the medicine of the evil, be surgery, because you have to pay.
It's
You
amazing.
take an organs out and you pay for it. Well, yes, you're gonna be healed, but you have to pay a big price. Or having a medicine that has a lot of side effects. You pay for it is medicine of the evil. So it's something that I kind of knew, and I could not really fit 100% in the Western background. But I did, I did my study, and I just didn't want to give them aspirin and have 6 minutes. You pay for 6 minutes to be reimbursed. About 6, 7 minutes. That's how much you need to spend time with your clients to see a lot of clients. And I couldn't just not looking at the cause. It was not my purpose. So I went to, I trained in acupuncture. It was very easy after doing Aikido because we were already feeling meridian stuff.
Was this during medical school or after?
So I started at 12 years old, and my Chinese master said, "Put your finger here," and say, "You're gonna feel something." And like, why? Oh, I feel something. Yep, you get a point. And then, oh, you get another point. So that's a meridian. So rather than show us a map with all the points, we had no idea. We just had to feel. So we developed my palpation. So I felt, oh, there's something there. Oh, you got it. There's something there. Oh, now this is a bladder meridian. Oh, okay. So it was really good to make us discover the gift. So when I have this training, I went to med school, and toward the end of med school, they have some medical specialty. They start to introduce acupuncture, homeopathy, and osteopathy. And I tried a bit of the 3, but everybody loved my hands and what I could do with my hands. And I was really, really fast learner. It was so natural because I touched thousands of body, moved them in so different place with Aikido and just know how to move things. And somehow I was very natural with osteopathy. And I was, I just finishing my school. A friend of mine in Belgium asked me to introduce some theory on the lymphatic system. If you could introduce all the theory and the medical background. And I worked on that, and I did my medical thesis on the lymphatic system. I got a medal from the faculty of Paris because I did a very big thesis. Everybody was doing like 50 pages. I didn't know I did like 300 page or 200 page. And then working with that, I just felt the rhythm. I just felt the rhythm of it. What you already mentioned, the rhythm of lymph. Just like they used to the cranial and feeling the rhythm of the cranial, I felt the rhythm of lymph, and my movement were so specific and so efficient because every of my move was feeling the right rhythm and the right direction. So I had a very fluid, something which is not like cracking and moving, very gentle, non-dual movement, fluid movement in the body. Because when you move one part of the body, the whole rest respond to it. And I begin to feel a very whole movement with a specific rhythm, specific direction, and specific depth. And just that, people wanted to learn it. So I was invited to the US. My wife was in the US. I came back in the US, and we had a huge empire of classes because everybody wanted to learn about the lymph system, but there was no good training. There's a German training, but it was very hard, very harsh, and it was like just pumping without feeling anything. People love to be able to feel, to surf on the fluid, follow the curve, follow the fluid. And I wrote the first book in North America on the lymphatic system. It's a book you can still buy. It's 500 pages. Everything: history, evolution in animal, evolution in embryo, and applications. And so I was known for the lymphatic system. And then I begin to, and my idea was obviously to work with, in osteopathy, you work for a dysfunction, osteopathic lesion or dysfunction. So you look, where is the key problem? And we have to look in the physical and sometimes emotional, sometimes mental, sometimes spiritual. So I had to learn all the systems. So I learned the fluid system with the artery, the veins, the lymphatics, and the interstitial fluid, all the other type of fluid, the cranial fluid, and then the muscle, the artery, the bone, everything else in the body. And that takes 20 years to learn all that properly and to right to understand, and then you begin to understand, the emotion behind it and the belief system, what it could affect. And so every year you develop your sense, and I develop more and more my sensitivity. So I really have one foot in Western medicine and one foot in looking at aura and energy, and seeing the family lineage and whatever we can see, because you want to find the cause wherever it is. And it could be in your lineage, it could be, in your chromosome, it could be in your environment, it could be in this system in your body or that system. So it's something very interesting that grow and takes a lifetime to really find the real cause of, the cause of a dysfunction in someone. Because it's not just for someone, it's one person with all their lineage, all their culture, all their collective. And anywhere here you can have you. So this is complex, but practically it comes back to finding a structure that has a problem, or maybe sometimes it's an emotion, and but finding a structure and finding the way to not invade it, not go against it, but let the body continue to grow, release. And the easiest way to do that practically is to find to match the problem rather than extract it and hurt it, to match the problem and use the self-healing, self-regulating mechanism in the body. So you don't have to use a blind force from outside to move the body, but to really feel rhythms, feel every dysfunction have a tendency and has a inner will to release. You just have to give them to let them, give them the right direction, the right tension. So you just match it, and the body says, "Oh, there's something wrong there," and then you have the self-healing mechanism that starts. So by starting the self-regulating, self-healing mechanism, you are going to be less invasive and be usually more efficient. And so you put less force, and you have more efficiency, than just trying to, at the beginning, try to help people and force people. And I know what to do, but I know what to do is what create problem in people. If I say I know what you need, I know what the agenda that you have often is not necessarily the agenda of a person. The person is a multiverse. I mean, you don't really know what's really happening at the source. So by doing that, you respect the thing and you begin to learn what happened. And I try to go in as many universe I can go, as many dimensions I can go in the body. Even I go in matter, sometimes I look in antimatter, sometimes, and then I try to feel the biggest problem, but I don't go and intervene like being, Attila or the Mongols and just invade you. And I just have to just see what you try to do there and then give you a proposition you cannot resist and release it.
That's beautiful.
Yeah,
And I'm sure there's so much more that you could keep saying about this. And
there was a lot.
no, and I would love to just kind of pause there and double click on a few things that you mentioned, because it
Okay,
really
perfect.
resonates with me. And I'm sure people who are watching this video who are keenly interested in health and wellness, and people watching might be in a pretty healthy state. They might feel good, but they're aware, they want more education, they want to optimize their
Exactly.
well-being, right? Prepare for the future. Other people might be really suffering from something as deep as a chronic disease or chronic illness and pain. Being in chronic pain is one of the most debilitating, frustrating things for people. And a few of the things that you touched on, even just going back to, I know it was training, Aikido training you had at 12, but I would imagine perhaps at 12, you didn't realize where it was all going to go
Yeah.
one day. You didn't know you would then become a medical doctor with all of these other technical trainings and blending together, which to me just intuitively feels like wholeness. You are looking at the whole person. And I think there's incredible Western doctors. However, some of them are trained in silos and their expertise is in one area of the body, down to such a small, like the wrist guy, the wrist surgeon, or the lung person. And to look at the whole body, one in a physical way and understand how it all is connected, bit obvious, but also on what I'll call a spiritual plane, in an energetic field. And you mentioned the auras. I would imagine something that's, my guess is very unique to your background, is having that sensitivity with martial arts that's the magic. When people hear samurai, you think they're almost beyond human because they have this capacity to feel. It's almost like they have eyes in the back of their head.
Yes.
It's because their senses are so fine-tuned more than the average person or even a very healthy person. They have this intuitive, sharpened sense that they can just start to feel the whole picture of what a person has. And without that training, I mean, who's to say where any of us would be without our initial childhood experiences or young experiences? But I think that martial arts training layered with Western techniques, education, and then coming to other more Eastern modalities, that's a very unique blend. Or maybe you can speak to that. Do you find many other people in the osteopath fields that also, I guess, feel into all of these areas that you
When
do?
when we train people, we want them to open to left brain and right brain. We need to do that. I mean, imagine if you only have your left brain, you'll be a robot, and you have a great techniques, but you have no connection with the people. And the connection with the people, it's part of your mammalian brain. I mean, if you see a little kid crying on the floor, just going there and holding the space and just listening and saying, what do you need? That is already healing. And you cannot take that outside of the equation and just be a robot. A robot coming and say, giving you a piece of the cookie is not just enough for his kid. He has so many things. We know that from a scientific experiment. We need this touch and we need this connection. It's very important to grow myself, to do work with my wife. We work on each other all the time emotionally, and and open our heart and have compassion and as you said, there's a time for the clients as for us when we need to get rid of a problem, but there's a time we just want to grow and optimize, as you said, all the different options we have. So people are there that just come for a backache, but then this backache is connected with a huge problem. I had somebody, maybe it was 3 months ago, he came for a very high blood pressure. And so the high blood pressure is a sympathetic activation coming from, to simplify, the adrenals, let's say, the adrenaline, noradrenaline, coming from the center of the adrenals, and you have the cortisol outside. And so you can think in terms of science, okay, it's high blood pressure. If I was an MD, I would just give them some very efficient pills and we'd be done 6 minutes. But I just see him in his whole totality, and I felt there's a big trauma with this person. This person. He has a very uncontrolled blood pressure, and the problem is he had a stroke, and if he continues, he's going to have another stroke, and it's going to be really bad for him. So I went there and I just told him, and I just, so I go into my little protocol and I say, I have the feeling something happened to you when you were a kid, maybe 5 or 6. And he said, yes, he kind of, I forget if it was kind of an abuse of some kind he had. And he said, yes. And I said, I think it's directly. I could see that even talking about it, the artery beginning to pulse more, the blood beginning to accelerate, you increase his sympathetic activation. And I just had the feeling he was hyper vigilant since the age of 5 or 6, waiting for whoever aggressing to come back every second. And when I was working, I was feeling he was not turning around. And like, I was safe, we're just here. You're in Vilka and everything is okay. But he was on the table at his age, about 70, still looking every 5 seconds, is everything is safe. The body is so hypersympathetic. And I could treat this tension, it would have been a little bit better. But by addressing the cause of it, you can imagine if I can let the body know that it's okay. That's often what happens in trauma. There's no sense of time and space. So you can have radiotherapy, 10 session, 20 years ago, you come and the tissue is getting drier and drier and more clear, fibrotic and fibrotic. Waiting for the 11th session of our radiotherapy, unless you tell them it's okay. You have to. So that's one of the things I do. Talk to the tissue. The brain of the patient or client knows, but the tissue doesn't know. It's okay. There's no more radiotherapy. Relax. There's no more abuse. And if the system come back to that's a lot of what I do, bring the system to threshold 0, bring them back to neutral and reorganize the system, but not just relax, really go on that system and regulate that system specifically so its blood pressure can lower. Doesn't need the meds, and you can avoid a stroke. That's just one example when you need. I mean, when you're a young kid, you just, try to fix the kidney or the adrenal, whatever, but it's not going to be long term. When you get those scars like that, you know, then you can even go fast, one more step. You get an abuse. Well, I bet whoever the abuser was, the dad was also got abused. And maybe it's a transgenerational trauma. You have to clear the lineage. And it may be also a collective thing. Maybe that they are Vikings and they used to, go and take everything, and they have to stop the culture of the Vikings. Something you have to work. You can go as far as you want, but you don't necessarily want to go that far. But we do it sometimes. So that's a way to work, and look where's the problem. And sometimes it's just mechanical. Somebody fall, their bone is out. You just replace the bone. There's nothing behind it. It's pure anatomy. You bring it back. So you can play with whatever, finding the cause, the key problem, where is the level. And it takes a lot of time to learn where this level can be. And like if you begins osteopath and chiropractor, maybe they go to the bones and the joints and the muscle, skeletal. Then maybe after that you go with fascia, viscera, brain, and little by little you learn more and more of the system until you get a certain maturity, and you can you can see more and more. So you have to learn, and I continue constantly to learn. One time, oh, it's a true neurotransmitters, and one time it's the organelles in the cells. Sometimes it's the mitochondria. So, maybe it's a nanoparticle of graphene in the body. It could be anything. So that's difficult and complex, and some people are easy to read. Some people are a bit more difficult because they stuff everything inside, or they don't want to be healed really. It's a lot of tricks. For example, we have people that come and said, nobody can heal me, only the Christ when he returns. And that's is in the background constantly. And if you don't understand that, they don't get better. And like, why? You have to find there's some games, nobody can help me. I am beyond. You have all kind of games that you have to go through, and hoops before you can read and bring back the person to their authentic self, which comes with a lot of vitality. Vitality comes
Absolutely. Yeah.
stuff a lot of energy by all this blockage and things. Yeah.
It's the human mind and the psyche, the physical body, the spiritual plane, it's one massive puzzle.
It is.
Right? And I feel you're someone who's able to play with a lot of different puzzle pieces. And just in my experience, I'm from New York. I lived in the United States my entire life up until about 3 years ago. And I had the, a privilege and ability to see some really good professionals, a therapist, a physical doctor, maybe it's a chiropractor. And in my experience, no one was talking to the depth of the professional experience that you have in the variety of modalities. And if you see a therapist, in no way was she checking out where in my body these pains were being held as well. And there are some therapists that work that way, but I think, with you, I think that's part of your magic, is that there's all these different puzzle pieces. And magic's my word, right? That's the word I choose to use, because it's like to me that just means a brilliance that you don't see very often, and there's something really special that people might not be able to put their finger on. And I can speak to this in town. Some people say, oh, Dr. Bruno, go see him, and someone else will ask, well, what exactly does he do? And the person's like, I don't even really fully know, but it works. Whatever it is, it just works. And I've heard that a number of times from people who have been seeing you for years.
Yeah.
And something else you touched upon is we don't know what we're up against in our own mind sometimes. The mind can be a trickster. It can be our best friend and our worst enemy. And for you to have this, I'll either call it a psychiatric background or just a deep intuitive sensibility, compassion to feel what somebody might not be able to even know about themselves. That's a big piece of the puzzle right there.
Yeah.
And I'm curious if you feel open to sharing some of these situations where a person, you sense that they were somehow holding themselves back from healing. Have you seen that either a belief system, because the mind is that strong?
Many cases.
Yeah. What does that look like, and how do you approach that? If a person, because you can't quite tell people easily, I don't think, hey, you're making this happen. This is you're doing this to yourself. You think it's your back from lifting something, but you tell me, what's the Dr. Bruno approach?
Well, as you say, first I go with my MDDO, so I'm official. I'm not the vote
Yes.
guy. So that helps a lot of
Check the
people just
boxes. Yeah.
the effect. But and it's a lot of experience and techniques. It ends up to being magic. But anybody you have somebody, if nobody before anybody pop the bone, they just do pop. Oh, that's magic. But no, it's a lot of technique. You don't pop a bone
Absolutely.
just like this. You have to know the angle, the direction, the velocity. So for example, my next class is going to be on that, feeding the physical body. And you have a lot of low self-esteem. And often it's in the duodenum. So after the stomach, you have this duodenum, which is 4 parts. So you go this duodenum, and I feel it's tense activity. There's no more. Everything else is neutral and relaxed. Here you have a beehive full of bees collecting emotions, a lot of activity. And then I will go somewhere in the brain and find what part of the brain is reacting to it. And then I would find an endocrine gland that's released it. So it's a protocol. But at the end, you're going to see this emotion. First of all, you identify the emotion, and with them, and they'll feel this emotion. I will work on the endocrine gland that release it, and then you're going to listen. And recently, I worked with a lot of population. They lost their partner, they lost their family member with, maybe the vaccination or. So I did a lot of heavy grief and heavy. I mean, somebody come here and what do you tell somebody? They just lost their partner, and they are such a grief. So I bring them back into the deeper silence I can find them to reset them. And they go such an expansive silence. And I use the veins. The veins are a reservoir of blood. You have 75% of the blood there. And you have a reservoir of silence and presence. So forget all happening. You go into your real deep self there and you go into silence. And I restart some rhythm at the last. Those rhythms are so gentle. And there's a rhythm called the inner joy rhythm. So I could feel that was like 30 years ago. I had one day a lawyers. I was doing books and just looking at the laws and all these books like the library rat, we call that. They steal a student and all those books and the laws. And right after I had a Brazilian girl. The Brazilians love partying. They forget everything. They just party. They're so happy. And I realized there's a rhythm. There was a difference in that lateral rhythm. The body was going laterally, different way. And I just began to explore. And that corresponds exactly to the inner joy. So I get somebody say, oh, you work too much. There's no more joy. If there's no joy, your body go in strike. If you get in the hospital for 4 weeks, you're going to lose your inner joy. And that doesn't help you healing. Sometimes I don't know what to do because nothing starts. Everything is on strike, depressed. But the physiology I'm talking about, I will start a little bit with inner joy. And I get, a lymphatic rhythm, a cranial rhythm, visceral rhythm, whatever other rhythm, I have all kind of rhythms. And that restart them. And then after that, I'm going to work maybe with the intestinal peristalsis. Because, when you're hypersympathetic or traumatized, everything shut down your guts. And you have low longitudinal muscle and circular muscle. It's a bit technical to simplify, and all that stops. And I just restart this, and then I will release the emotion. And I will leave, and they were like, wow.
Wow.
They are just like, okay, but
If someone had asked them at the beginning of the session, what do you think is going to be the problem? What do you think it's going to be diagnosed? My guess is they never would have guessed that that's where
and me
was
neither.
underneath it all.
Because and you have to be okay to not know at the beginning.
Yeah.
And just to receive the person with what they have.
Yeah.
That's a problem because you come with an agenda. Okay, I have 6 minutes. I'm gonna do the minimal. I know what you need, but when you don't know what they need, you just receive the person and you receive and wait what they present to you, how far they want to go, where they want to go, and you just try to serve them. I help their rhythm. I'm not going to impose my rhythm in their physiology. I have to, yeah.
Well, I was going to say, I think this is an interesting point to go a bit further on because sometimes people ask, like, okay, well, what's a typical session look like? Well, everybody's so different and everyone's coming. So
Everybody's different, but I mean, this thing I don't do, I don't crack. I don't need to crack.
Okay.
Same place,
Yes.
I don't need to. You can keep you cool most of the time. You don't have to take out some people. Sometimes they don't like respect except the German. When you teach Germany, they're just telling you they're so used to go to spa, and it's quite gentle. I try not to rarely use force. Sometimes a bone is out, I have to go in trousers to replace it. It's just a little more uncomfortable, and I've got to work between a system in the body, physical system. Maybe I've got a muscular system or bone system or visceral fascia fluid Maybe I'm going to go in the electromagnetic field is to cooked, or maybe I'm going to talk about something touching an organ. She says, what do you feel there? Like, there's a lot of rage. All right, what do you see? So I will have some picture for me, and I'm used. So I like, oh, that's the dad, she's on her dad, and I'm wait because I'm used to it now. I don't have any. You have to say neutral. I know I'm neutral enough, and then she says, oh, see dad. Say, oh yeah, that's what I feel too. What happened with your dad? And then we begin to release the emotion in the tissue. So when I touch, I'm trying to have a lot of dimension, the physical dimension in my hands. But when you talk about our anger, the organ is moving a little bit.
And you can feel that. You can
Yeah.
physically and also, I would imagine, energetically sometimes to feel
A lot
the
of
shift.
heat, of activity, or this
Right.
anger, maybe a lot of, you see color red, or some people feel, oh, tingle a bit in the
Yeah.
hand. So you touch that organ, and when she talked about, oh, she said mom, or father, brother, and when she said father, what, we begin to move and try to reorganize.
Yeah.
So you get a little bit of a response, and then you work on it one way or the other, until when you think about it, like, oh, I cannot even be angry anymore because.
Yep.
So it's better to go with my wife if you want to work on it, to go really with a bit of dialogue and consciousness. But many people don't want to dialogue too much, so I just help it with my hands and very minimal dialogue, and you just know what it's about. And wow, I feel good. And
Yeah. I can speak to this personally because a session that we did together, it was quite similar to that. In
Yeah.
fact, I'm wondering, like, are you channeling the session that I had with you a while ago? Which I don't mind because I came to you because I'd heard such wonderful things, and also I'm wise enough to know I don't know what I don't know, and I was wondering where might I be stuck? A lot of life transitions going on for me. I didn't come to you with pain or an injury happened or something that's really suffering from, but I knew you a bit through town as well. I'm like, oh, I got a really good sense of you and your wife, and I'm curious. And that was the experience. It was a very, I'll call it light touch dialogue where you were asking a few questions, a little bit yes, no, or tell me a bit about that. And I just had to maybe one sentence response. And all of a sudden you were identifying things. I remember laying there thinking, how does he possibly know to ask this? Like, there's no way. And I think I peeked my eyes open. I'm like, is he reading this from somewhere? Where could he possibly be getting this information from?
The internet.
Exactly. I'm trusting you to not Google, and not that that's even on there anyway about what we were doing. And I could catch myself. I was really present in the session, but just thinking, wow, this is very interesting. And I don't want to use polarizing words, and I'm not saying the word psychic is accurate, but I felt like there is this very special thing that you tapped into that I don't have a logical explanation. And maybe this is your modality. Like you are explaining right now because of your 20 plus years of experience with humans and the physical dimension and also the spiritual dimension, all the modalities blended, you're able to guide someone. And there were some memories that we talked about. And I thought, this can't possibly still be bothering me. There's no way. Going back to that first patient you were speaking about, the fight or flight response, as we spoke deeper about this particular thing from being a kid, and I could actually feel I was sweating. I started having a response and being triggered and thinking, why is this triggering me? So I just want to say it's pretty accurate. To be surprised at what comes out.
Well, you have what you know, what you think you know, what all of us know
Right.
the best, and your cells. Some of your cellular memory still is affected by this. It's
Yeah.
not only.
And my mind doesn't realize it because
Exactly.
I'm having a physiological reaction to this thing, kind of just even having a memory.
So I make sure the blueprint is, release all that, not just what your mind has, and release all this to your body physiology. Because
Yes.
if your cellular, if your cells are reacting to this, they probably do it many times during the day and takes a lot of your energy. And when you're hypersympathetic, your immune system is at its lowest. You have less blood flow in your brain, your frontal lobe.
Yep.
You have a lot of things. So you need to have this energy to help your immune system regenerate your tissue, think clearly, and all that can be used for your health rather than just every day. Like this guy that was hypervigilant, all day, how much energy is spending or what?
Absolutely. And it's being taken away from all the other, even basic bodily functions to get you at a baseline of healthy, let alone optimized, and in your highest self expression.
How much love can you express when you fight a fight? Because you're not in the same place in your brain.
Mm-mm.
You know the same compassion. You don't have the same understanding. You don't have the same brain.
You're out for
When you-
survival.
yeah.
Yeah, you want
So
survival. You're not compassionate. Survival. Yeah, you're in kill mode. protect yourself and protect your own, like
Yeah.
in that
So if you are
metaphorical
there
way.
24/7, basically, because this guy was protecting himself from the next aggression, how much harder he expressed he has a relationship? He was not nice.
Mhm.
Couldn't trust her
Yeah.
because of that. He couldn't forgive her because of that. He couldn't express open his heart all the way because of
Yep.
that. So if your heart is not open, something your constriction, pericardium,
Mhm.
myocardium, and you have a coronary artery that's gonna, so all the
Yep.
things are coming. So you could see that a lot of these hypersympathetic is a cause of a lot of problems.
Yep.
A lot of those negative thoughts coming all the time create all these
Hmm.
changes in
And I'd
physiology.
love to use two words, blockages and entities. Maybe you want to speak to those because
Entity is even less
this is,
effective.
yeah, and I think it's important if that's
No, it's very important, but it's just
interesting.
not
Yeah.
scientific at all. It's really perception we have a lot with the entities.
Hmm.
When basically, if you don't take your own kingdom presence,
Hmm. Hmm.
something else in universe gonna take it.
Yeah.
What you said, nature abhor void. Is it something like that? Nature abhors void. This abhors void.
Okay.
Yeah, so basically, I mean, this is a bit more advanced, but it's the fact that unless you express your light and your love
Hmm.
and your compassion and your wisdom, every time you do something else, including anger, you're probably controlled by something else that is not really you.
And it's attracting more negativity.
So even anger, we say, oh, that's almost one of the human emotion. It's not.
Interesting.
Imagine whoever imagine an archangel is.
Yes.
So what kind of behavior he would have
Hmm.
as the highest emotion you could have? What is the highest? You even see anger there, or you even see compassion, love, and
Nothing but love. I see clarity.
light and
Yes.
so
I am not at that level though.
no, we
I
are
still
not.
get angry. So I'd like some, maybe you can give some advice here to anyone else
Everything-
listening too.
But it's just
Okay, good to
when you
know.
get there, catch that as not. It's not really coming from your authentic self,
Sure.
from your higher self.
Yeah.
So it is some kind of, you could say that's an entity, a
Yeah.
collective human entity, and you have a lot of the little things to a point when a
Yeah.
couple fight, usually the man is thinking something is going to happen. This is going to happen again. This happened to me 20 years ago. It's going to happen again. So I'm defending. So I'm not here.
Yep.
I'm not talking about this person in front of me. And the wife is doing the same thing. She's not fighting about this thing, but something else happened somewhere else another time. Nobody's here, and
Yep.
two entities are talking to each other.
Yep.
Not their full human being. So I mean, it's a concept. You could like it or not like
I
it.
was just going to say that it's almost like an archetypal description to describe to people the metaphor, the story of what might be happening. When we
Yes.
are out of alignment, when we're not in our highest expression, I think people are naturally beautiful, wonderful, soulful beings that lean towards the good, towards the compassion, generosity, and light. And things knock us off our highest self. And we gravitate towards somewhere in the middle, or sometimes that, if you call it lower self, in yoga, these are the words that, my practices use in my training. And too much in the negative sphere, if we find ourselves engaging, it like attracts like. It's going to bring in other things that then start running the show
Yes.
for you. And whether people call it an entity or there's another vocabulary word, I don't get super hung up on as like this is the exact definition of it. But for folks to know, there's a real energetic thing that's happening.
The entity, in the concept of the entity is eating. You get angry all the time, eating love, and use this energy used for that entity rather than for your higher self. So it's like something exterior that sucks you basically.
And I want to just use a simple example. We all walk into a room where someone might be having a terrible day. You walk in there and you just feel whoosh, like they just suck the energy out of me, and that's just a simple, like, everyone can relate to that. And it happens in so many different levels and it can be so subtle and tricky, especially when you don't realize you're in a negative space or something's an energy vampire
Yes,
for you.
energy
It's sucking it out.
Now people are afraid to the word entity because you think about exorcism or whatever, but it could be just neutral. Something is not you're not there fully, and we're gonna bring you back.
Yeah, absolutely. And I think folks who are watching this video, they are so open to alternative ways of just thinking, of lifestyles, of mindsets, of healing modalities, and very, open-minded in the sense that there's a lot of different systems out there and there's a lot of different vocabulary and a lot of different practitioners. So my personal belief, which might not be for everybody, I think there's a lot of truth in all these different modalities, right? And I gravitate towards, okay, what about this modality do I deeply resonate with? And I feel a connection. I just feel, yes, I feel truth. Another person might not, and that's okay. And so the way we're speaking, I think thank you for sharing this because it's a part of I think your philosophy and your whole package, the approach that you come with. Um,
Yeah, and develop techniques that are the least invasive to be the most efficient to work on babies. And I work with the same technique,
mhm,
work on animals. So I taught all the osteopathy in the States for 20 years.
yeah.
So I practice, I would say almost 40 years since I'm 12 years old, but I teach for 20 years.
Mhm.
You have to teach them alternative way than cracking, and they don't even know how to work with veins. So sometimes they don't work with to work with the lymphatics. So I bring them different system to work with, try to be the most gentle and the most efficient. So you can work on baby, on older senior citizens or animals, and you can apply because an animal is going to bite you if you begin to
Yeah.
crack them. So you need to kind of connect with
Mhm.
them and not being in duality, opposing and pulling and
Yep.
pushing. You want to kind of be with them and they understand that you have a good intention and do a gentle technique that's going to release them without hurting them. So you have to
Absolutely.
develop that. So this is what I try to develop gently. And it's fun. And I just very creative. Basically, I just have a lot of technique coming on and I just experiment
Yeah.
them on many hundreds of people and then it works. And then it becomes magic after you have done it
Yeah.
thousand of
Okay, you use the word. You use the word this time.
because you guys call it like that. For me, it's just I don't even somebody talk to me at night and I just listen and here's
Yeah.
a new class. No, there's a new way to do that. Oh, this is a way to do
Yes.
that. Yeah.
It's really wonderful, and you're in flow. Again, these are my words here, my kind of yoga spiritual words. I feel a flow that you tap into of just, yeah, it's a flow state. This is what some people call it. It's just
Mm-hmm.
you have all these modalities. It's not like you're looking up all the books or the person's on the table. You just intuitively know where to go, and you're guided, and you're open. You let them guide you. And I so resonate with what you said now and earlier in this interview. Is the least invasive first with a gentle touch, gentle approach. It could be subtle and energetic, and just those nudges, wow, can the body get back on the right
Mm-hmm.
path to healing without invasive medicines,
The least
procedures,
force.
surgeries that people sometimes
Yes.
get that are actually unnecessary?
A lot. I avoid a lot of
Yeah,
surgery because I bring back the
yeah.
physiology and I mean, I don't know. I mean, even backache, they don't know what to do with
Mm-hmm.
surgery, but there's a lot of
Yep.
things you can do. But
Some,
there's a lot of people that work on backache, but there's so many modality. People, I don't know what do we do? It's concussion. What do you do with a soldier coming from Iraq? You have 25% of the kid coming from of the young population in the US that has been to the army, and
mhm.
what do they do with them? Some are totally sleeping and depressed, and they're going to divorce. Some are totally hyper and irritated all the time, and they're going to divorce. They cannot function, they cannot work, they cannot concentrate, they cannot multitask, they cannot have a job, they don't have a good memory, they don't have short-term memory, long-term memory. And it's just the fact that their nervous system has been rotated, have been traumatized by the bomb blast they received. And it's super easy for us to work on that. It's nothing for me. One or two sessions, and actually, I went to Washington D.C. and presented some of the work we could do, but they want only pills. They don't like the hands. It's like the hands. Who cares? But I tried to do a study for that, and there's things we can do in 2 seconds. Like strabismus sometimes takes, it's nothing on the young kid or dry eye 3 second ding, dry eye, no more dry eye, no more this. So there's so many tricks we have because now we know how to do it. There's protocols. Some pathology I don't know, but I see them and then I discover something comes, and so the more I'm exposed to it, I'm just open and learn new stuff all the day
Yeah.
or every day.
Wonderful. There's a phrase that's often used, personalized medicine or individualized
Mhm.
medicine. And this, I just got a hit of that as you're speaking because it's really about the individual and what
Right.
all their past experiences and yes, all their past experiences, perhaps in this lifetime and others, or the generational thing. We don't know what we carry from our ancestors in
So
the
we do
field.
have a collective. We're all human, have more or less the
Yeah.
same physiology, the same hormones, but we also have a different life purpose. So
Mm.
there's something common
Mhm.
to all humans. You
Mhm.
have a skin, you have
Yeah.
a mouth, you have two eyes, but there's something that is very particular to
Yeah.
you. So it depends. Where's the key problem? Is it something that's more belong to all humans? Really, really something specific to your path and your purpose in
Right.
life. And my great joy, I always said that. When I was like 30 years ago again, I don't want to treat your liver. I don't want to treat your ankle. I don't want to treat your brain. I want to treat you coming back to your own capacity and who you are. And I remember, I went a little bit with the American Indians. Sometimes the shaman in some tribes will ask you, okay, you come for broken legs, but
Mm.
why do you want me to heal you? Are you going to come back home and after I heal you to uh, uh, beat your wife and being drunk again? or why do you want to do it? Oh, I'm not just going to fix your legs.
Deep questions.
Yeah.
The deep
What do
questions.
you want to
Yeah.
heal you? What are you going to do once you're healed?
Yep.
So those questions are never asked, but it's nice to sometimes ask them.
Yeah. Yeah,
Yeah.
absolutely. Well, this is, I think you've offered such an insight. It's been a privilege for me to hear this because I've known you, we've had many conversations, but I even learned a few things about your kind of your process and background. And it's just, it feels to me like each person is their own beautiful mystery, and you're helping people figure out how to get on their best optimal path to healing.
Yeah, the most I can, because as you said, mystery, you don't know. You have to stay humble because you cannot really understand everything in the person. You do the best you can, not to be too invasive, and trying to help them
Right. The guidance.
go where you think they should go.
Right.
With their help, you just help them, again, use their self-healing mechanism, and try to feel the different places when it can be blocked, every like a year, or something else. And it's fun
Yeah.
because you have people that blossom out. You have people blossoming up without pulling on the flower to force it to grow. Just, that's what they need to.
Oh, that doesn't work really? That's like pushing the river,
Never.
forcing the flower. That's a new one. I'll use that one
Grasping
too.
the river.
Exactly. Right. All of that effort, the
Yeah.
balance of grace.
That would be good if we had a mechanical body. So if you have a mechanical body, the
So
more
much more.
power you use, the
Yeah.
more it will be a machine that works. But we're not a machine.
It's so much more than that.
Sometimes you have one drop of one hormone, which is very soft, and that little hormone is going to drive you crazy.
Yeah.
Well, another, or you have one information from a neurotransmitter, and so those are the little things that can create a lot of challenges. It's not just pulling and pushing.
Yeah.
And again, because you are made of 70%, maybe 60% fluid, you're not you're not going to squeeze on the fluid and trying to do something.
Right.
There you have to have a different
Yep.
approach. That's why if you include the fluid, you have this kind of tendency not to try to control, because you can control the fluid.
Yep.
So that's, plus you have air between the atoms, you have a lot of space. There's a lot of information in matter. So, I mean, if you're not going to control all that.
It's the complexity and just raw beauty of being human. We are complex creatures, right? On so many different levels.
Participate, I'm a host, I'm a guest, so I'm a guest and I'm mentoring you. I am honored to enter your physiology, and I'm just a guest here. So I have to be a respectful guest, a witness of what happened, and just support. And
Well said.
yeah.
Yeah, very, very well said. I'd love to ask a little bit switching gears, but all connected here to Vilka Bamba. And so you have been living here in Vilka Bamba. This is where your in-person practice is, seeing people physically. I know you run a lot of work online, digitally, from your beautiful home here. And for people who are attending this retreat or they're interested in attending the retreat, they'll be able to see you in person for one-on-one sessions. If you can speak a little bit about, we'll get to Vilka Bamba in a moment, and I think we a bit covered on this, but for people who come see you in person, right? We've identified that each person is unique, has their own path, and you help them on that path. Is there a norm or rule of thumb of how often you can see people or how long the sessions are? What might people be able to expect in that framework if you're able to offer that? If not, it might just be each person, it depends.
No, it usually is 30 to 45 minutes.
Okay, it's the length of the session, a single session.
Because I could rush and do it everybody in 15 minutes, but you want to just, give them time to integrate, and sometimes you work with, their life. But sometimes it's mechanical and it's done very fast.
Yeah.
And I'll tell them, hey, I need to see you in 2 weeks. I need to see you tomorrow. Usually it's like 2, 3 weeks.
Okay.
It's walking, it's a lot of challenges.
Yeah.
I have to integrate. But it depends. I'll tell them, depending what it is. Yeah.
Yeah. Okay. And all of this happening here in Vilka Bamba, where our retreat is going to be. And for you, maybe you can speak a little bit about what do you love about Vilka Bamba that's called the Sacred Valley, right? And it's all of the Valley of Longevity. And there is an attractor field here that I feel so potent and so present. And I think everybody who chooses to live here feels it in some way. And I'm curious if you're open to speaking about what is it about Vilka that's got you.
The place we are is a place when they used to have healing after wars.
Yes.
So the Incas.
And which were Incan, exactly.
Yeah, the Inca soldier will be, the trauma of war, they will come here to rest and regenerate. So it's perfect for the retreat.
To our Vilcabamba Valley. Yes, exactly.
So after being in the war in the US, in Canada, and wherever place you are, and if you're in the war zone, you'll come in a place like this to heal and regenerate. Where we are now in San Joaquin, specifically.
Which is your neighborhood,
It's
your
our
barrio.
neighbor. It's about
Mhm.
10, 15 minutes from center of town. Is a specific place which is wonderful for us as healer, but could be really cruel. The
Mm.
energy is so strong. It's like you sit on the Earth meridian, and the energy is so strong that everything goes up, and people we love to have this material coming up and discover, hidden emotions or
Potency.
so all kind of things lifting and clear them and you clear them and we love to this new material. Oh, I didn't know this about me, I didn't know that about my wife. But some people have those material and they get angry, they get sad, they don't know what to do with it. So we love it because here it's not
Yes.
going to be in Ishkaluma, the retreat center. We can see the energy there, but
Mhm.
where we are is powerful, and that's what we love.
It's I'd say like a hot spot. It's
Yeah,
what's
it's like a
happening here.
vortex.
Yep.
But it's more than the vortex. Vortex, like you have in Sedona, it's one spot, but here it's like a whole.
I'm so glad we're speaking to this because I feel it too. And I don't live in this neighborhood, but different areas in Boca Bamba. I would say there's a confronting energy sometimes. It's not a permanent thing. I feel 24/7, but you face your own stuff.
Yes.
And I think for people who are looking to do that, or maybe reluctantly, but no, they need to, you can't hide from yourself, from your
Yes.
shadows. You get into situations here. I'm like, okay, what karma am I working out right now? I mean, there's certain things that I can't believe are happening. And I think, why? Why? And I talk to people and as us as residents, there's a really cool camaraderie, I feel, with
Yes.
other friends and
That's
people
for
here
sure.
because it's happening
Yeah.
to all of us in some way. And the more I open up about it, the more I feel like, okay, we're in this together.
Yeah.
We are all in this spiritual healing. Also, you got to kind of get through the bad to get to the good
Yeah.
sometimes.
Yeah.
And that happens here in
It's just a
Vilcabamba.
great place to grow.
Ah,
So if you
well
want
said.
to grow,
Yeah.
it's fantastic. If you don't want to grow, it's cool.
If you like to hide from all of your work, do not come here.
Come in. But we love it. We really love it. We have never grown so much and so fast, and we love it. And we
Wow.
feel
I feel like that says a lot for both you and
yeah,
Elena.
because we have worked a
That's
lot before.
exactly. This is your world and your
Yeah.
profession.
It's
Absolutely.
just they used to say, well, the energy is in Tibet, you have all the wisdom, but you feel somehow it's here now. The energy that the spiritual energy is whatever it is here to have
Yeah.
to grow.
I think especially in the time that the world is in right
Yeah.
now, every decade or whatever number of years has potent things going on globally, and I feel we are in a potent place in the
Yes.
timeline of our
Yes.
experience, and somehow
Exactly.
we're drawn to this location on this
Yes.
grand planet, this little dot on the map. We are all here kind of in each other's lives for a
Yeah.
reason. And for people who come down to the retreat, especially because it's 21 days, that is a nice amount of time to be doing your self work, but also feel and integrate with the energy that's here and meet some of the people who live
Yes.
here. And we all feed off of each other because we're
Yeah.
part of each other's story for a reason.
Yes, it's like a little village and everybody help each other. And,
Yeah.
we came and after 3 months, we knew 90 people and every week you have a birthday or something, almost.
Yes.
So it's just like you have this wonderful support
Right.
and it's very special.
Well, thank you for speaking to that
Yes.
specific about Vilka Bamba because it is part of the container that we're hosting for this health and wellness retreat. And as a team, at Abundant Living, we're speaking about it. We just feel so confident that it's going to be an incredible experience. There's going to be some things that are going to be unpredictable that are going to come up, and we have to be open to sensing what does this valley want to offer us, not just us as people planning and organizing a 21-day experience, but we're also tapped into like, okay, what's coming up and what wants to be presented and what wants to be part of the container for people to have this really rich kind of in-depth journey while they're here.
Yeah, I could see if I was in the US or Canada or something like that, I may not have this opportunity to have this very special stimulation.
Yeah.
Do an enthusiasm to grow like that is something.
It's an X factor. Do you know that phrase? An
Yeah.
X factor it means the unpredictable. I can't quite name it, but it's a factor.
But there's this energy inside, and that's gonna.
Yeah, it's gonna come, whether we like it or not. And we'll handle whatever comes our way. That's part of the adventure of this whole thing, too. We can't be so kind of clinical and exactly what the experience is going to be. We have to stay tuned to the field and see what rises.
In osteopathy, this is called a load on your homeostasis, a load on your organism or on your physiology.
Yeah.
This load is there. So whatever is going to show up and be released. And this load is going to create in 10 years a heart attack, a stroke, a depression, a cancer. This chronic disease come from things that has not been addressed. So if you are honest, and it looks really horrible to feel whatever you feel or to have this experience, but when you think about it, it's much less than having a cancer with surgery, chemotherapy, radiation, whatever you're going to have to go through. If you can just, Alaya, go rid of 1 year, she got rid of how many cancer in 1 year? Just they have to go feel that little feeling. Oh no, you feel it for 5 minutes, you are done.
Preventative.
And sometimes that's the best way to prevent medicine. You're something that
Yes.
attacks the economy of your body, of your organization, of your physiology. You need to release those. So you have to think that whatever is released is going to avoid a bad relationship, bad choice of relationship on an emotional level, a bad posture, a bad immune system, a bad disease. All those are going to be preventing something. And that's what you have to release. It's just a wonderful opportunity to be healthy and vital and more loving and having a better life.
Absolutely. And I feel like that's a wonderful note to kind of bring home, right there. And I just have to offer a thought and then ask if you have anything else you'd love to share. But I love that word preventative that we were just saying. I say often optimizing, right? If you're not sick, well, then that's great, but you're in a good state of health. We can always continue to optimize and be in a good state and prevent as best as we can
But
things coming through the door.
just to make me realize, I am not, my teeth are okay right now. I'm not going to brush my teeth until my cavity comes.
Yeah. Uh-huh.
You know what I mean?
I know.
Think about it. We do that for our
It's the
teeth
daily maintenance.
every
Yes.
time. So you have to.
Let's not wait for the problem.
Yes.
Yeah. And I think
That's part of our job to kind of work on this.
mhm,
You have a life and you balance all aspects of your life, and
mhm,
you
mhm.
balance also your social life, you balance your relationship to yourself, and all that is part of what keep you healthy.
Yeah, absolutely. Well, Bruno, this has been an amazingly fun
Yes.
conversation.
Yes.
I appreciate it. Is there a final thought or share that you have for either the context that we've been speaking about, your story and the work you do, or for people who are coming in October or considering coming in October?
I'm not sure. What we work right now with our life and with my wife is well, love is very important for us. Something very important for healing and we just understood more and more that it's something that's not necessary.
Hmm.
You can live without love. You can be rough with everybody, and you can live without respect. You go to a jail, there's no respect. You can live with no respect.
Yeah. Yeah.
But when you realize respect, if you give respect to somebody, you're going to receive respect. You evolve already in some level, and you begin to share love and receive love. You raise to a certain level of humanity and then completion. And your body, by me touching the lymphatic system, the fluid body has to do with emotion and love. And you can see how things flow again. Don't get stuck, especially type A people in the arteries, the artery flow a little bit better. So just when you begin to change your attitude, your neurotransmitter is changing, the cocktail in your brain is changing, all that is changing, and it creates something absolutely amazing. And you could begin to fight with your neighbor for a long time, but when you could, it's not necessary to love. But we realize the more we do that, the more healthy we become.
Absolutely. And love is one of the key ingredients to longevity.
Yes.
There's actually science that has proven that at this point. And I know you know this, and I feel it. I mean, it's for me, I didn't realize it till about 15 years ago, some research and studying I was doing. And I was so moved and glad that there has been scientific studies, around this community and love and
laughing too.
Laughing.
Help you health. You know that with each other keen and all
It's the
kinds of
joy.
stuff. Yeah.
Yeah. And the cosmic giggle. We always got something good to laugh about. See, there we go. The cosmic giggle.
I like it.
Amazing.
Yeah.
Well, Bruno, thank you so much.
Pleasure.
I appreciate the time. And for those of you watching, thank you so much for enjoying this video. And again, a quick reminder to make sure you subscribe and like this video and hit the notifications because we'll be having a lot more content just like this one, interviewing amazing practitioners here in our local Vilka Bamba Valley. So until next time, thank you all and thank you so much.
Welcome to Vilka.
Ciao.